Eastern Cape residents have raised concern regarding the lack of proper care in public health care facilities. Maclear Hospital and Nelson Mandela Academic Hospital have been criticised for providing subpar services, with incidents ranging from inadequate medication to malpractice, leaving patients stranded and helpless. We're now joined by Health and Allied Workers Indaba Trade Union President Sicina for more on this. Rich, thank you so much for your time. Many times we've been reporting about how the healthcare system in the Eastern Cape particularly is near collapse. Just walk us through what are some of the concerns that have been raised recently.
Thank you, Unati, for having us. Good afternoon to the viewers at home and also the members of Health and Allied Workers in Indaba Trade Union. You know, Unati, I was even saying this morning, it's like all of us, majority of workers in the public healthcare system have reached a stage of I don't care anymore. It's so sad. I was even saying, guys, let's at least now, let's do it for God. You know, we go as far as say it's like we are hopeless. It's not the situation, it's dire. It's not only in Eastern Cape, but across the board. But when you zoom closer, Unati, you realize that our problems, we have actually 4 problems. There's gross shortage of staff. There's gross shortage of material resources. There's gross, there's dilapidated buildings. And as a result, all these 3 things, they affect the morale of the staff. As a result, everyone have been absorbed. Majority of our colleagues on the ground, not only nurses. You go to pharmacy, you go to, I was saying, from the office of the CO to the security, it's like we've been absorbed to substandard way of doing things. We have been reduced to nothing, and our existence have been rendered useless. The system, yes, the system is falling apart. Those in positions of authority, they do not care. But now, even workers on the ground are not helping it, because they also saying that I don't care attitude is there. And I've always said these facilities, Unati, our healthcare facilities, it's your hospitals and clinic, they will never function well like a well-oiled machine unless they are worker controlled, because those in positions of power have proven beyond reasonable doubt that they are not going to transform. They are useless in as far as transformation of our healthcare system is concerned. If I can tell you the repercussions of this, I don't know. That is why many will say we don't want NHI get rich, if you are speaking like this.
Yeah, I mean, in September of last year, the MEC of Health at the time in the Eastern Cape, announced the redeployment of the head of department. I mean, it was said at the time that the decision was taken to strengthen administration of that particular, department. But I mean, as you and I sit now, there's a new sheriff in town. There's a new MEC that has just recently been appointed this month, Ntandokazi Tsapa. I mean, do you anticipate any changes here?
Not necessarily, not to tell you the truth. That is why I say until these facilities are worker controlled, until myself as Rich, I'm employed by Tellemukhoran Regional Hospital in Vosloorus. When I go to Tellemukhoran, I must treat Tellemukhoran as my second home. As a result, even if you can bring the best MEC under the land, but the issue is that workers on the ground, the morale is so down, and you are talking to the issues of poverty level salaries. So when you come, you like myself, we are a new broom. You want to sweep well. But now the problem is that out of 20 people who are in managerial positions, you are the only one who's saying, let's excel and produce quality. Let's go out there and be of good service to humankind. And no one is speaking your language. The people who are entrusted to transform the system with, even if you bring that particular MEC, but they your CEOs, your nursing service managers, your HR managers who have given up as well. They will actually tell you straight when you say, we actually can do this, we can do better. Let's try to 1, 2, 3, and 4. And they will actually tell you, Anati, to say, we tried that. We've been here for as long as you can remember, and it's not going to work because workers are not going to listen to what we are saying. Even that is why I'm saying, even if you can bring that particular MEC must talk to the workers on the ground, must go down to the workers and be transparent. Tell us, why are you not hiring many doctors? Why are you not hiring nurses? Why are you allowing a situation where 45 patients are nursed by only 3 nurses? There's no way those nurses are going to excel and produce quality. And again, as nurses in particular, we are good in improvising. We improvise. We work well under pressure. That's what we always say, because we are scared of, even if we want to stand up and say no to mediocre, no to substandard way of doing things, there's South African Nursing Council here on the side that will go for you if things go wrong. So that is why I'm saying, even if the MEC comes, you must rope in South African Nursing Council. You must rope in HODs, CEOs, and all managers across the board. Let's go down to people, those who are supposed to do the spade work, and tell them that this is our country, this is our healthcare system, because even though the system is falling apart, Unati, but workers on the ground as well are really not helped. There are those who just go there to be rude in the true sense of things. The community, they are not complaining about something that is not happening. There are those who are failing to do basic stuff. That is why this community is always complaining. Those rude people, those rotten potatoes are there, Unati. We just need to be led properly.
Yeah, and I mean, what is concerning, we reported not too long ago about how the crisis in the Eastern Cape in terms of, just the situation on the ground, when you look at malnutrition in children, for instance, I mean, over 100 children were hospitalized just last year with acute malnutrition, some of whom have, of course, died. You speak, of course, around the workers. Just paint a picture for us in terms of how patients themselves, those that are neglected or not even assisted, are doing.
You know what I mean? Like, for example, I was saying this morning, do you know why many of healthcare workers do have medical aid? We actually have medical aid as healthcare workers. You're talking about doctors, allied workers, nurses, and stuff like that. And I was saying we are all selfish, by the way, because we have medical aid, so that when things go wrong, when we need medical help, we run to private sector, a sector that is well resourced and stuff like that. And because we are running away from the chaos that we see here, those patients that are neglected, we have had patients that will stay in casualty in our emergency department for 7 days. You will stay there in a stretcher. Already you are in an uncomfortable position because you are sick. You need to be taken to the ward where you will be taken care of by nurses. But we are staying in casualty, in a stretcher, sometimes in a wheelchair, because the hospital is full. Our hospitals are actually overpopulated. So in our hospital, there is a vicious cycle to an extent that even the doctors in the ward, they will discharge the patients who are not ready to be discharged to go and die at home. Why are they doing that? Not that they don't care, not that nurses can't stand up and advocate for these particular patients. If we are advocating for those in the ward, what about those in casualty? Others die. I once attended a funeral of a mother who died in casualty after staying there for about 7 days. So it does, even that kills our spirits as well. Because before we are nurses, before we are doctors and allied workers, we are from the community. We see this, we are aware that this is actually wrong, man. Why the system is using us? That is why we always say, as health and allied workers in the Indaba Trade Union, see, the system is using us as accomplices of murder. It's like they are unleashing us to say, go out there, produce substandard performance and mediocrity so that we can depopulate South Africa. It's like, it's crazy. But what can we do, Una? That is why we are sometimes pushed to think that. But we will have to make noise and use such platforms to say, all of us, we must come together. Even the community sometimes doesn't help us because they come to us, they because of lack of information and ignorance, they come to our facilities and swear at nurses again and blame nurses. And in particular nurses, more often than not, and doctors, without understanding that we are also in between the hard place and the rock.
Rich, thank you so much for that. Of course, a tough situation there for both healthcare workers as well as patients. Thank you so much, though, for your time. That was Health and Allied Workers Indaba Trade Union President Rich Sicina, of course, just putting a plight and a spotlight on what is currently happening at some healthcare institutions in the Eastern Cape. Of course, not a pretty sight. There is, of course, a new MEC that has been appointed to look after health in the Eastern Cape, given the 7th administration.